It has been far too dry. We get some Gulf moisture coming in, not tropical like storm or anything like that. Just an 80% chance for showers today and tomorrow, although we're off to a sunny start here in the CBD at least. Then a 70% chance for showers through the Labor Day weekend. But again, we need the rain so long as it doesn't come down too fast in too short of a period of time. Dr. B joins us now. Dr. Brent Wallis, Chief Medical Officer at People's Health. Morning, Dr. B. How are you?
Hey, Tommy, I'm doing good. I'm looking forward to the rain.
You got that right. Me too. Nearly half of American adults have high blood pressure. That makes it one of the more common chronic conditions, but only 1 in 4 adults with high blood pressure has the condition under control. Dr. B is going to join us right now from People's Health to discuss the importance of routine blood pressure readings and share tips for keeping your blood pressure low. And, Doc, this is really something that's very serious that people need to pay attention to.
Yeah, absolutely. I mean, so many people have high blood pressure, some who don't even know about it, and it can cause all kinds of health problems.
Tell me about blood pressure to begin with. What is it?
Yeah, it's pretty simple. The concept is really simple, actually. So blood pressure is just the force of blood against the walls of your arteries in your body. And the arteries are any blood vessels that carry blood from the heart to other parts of your body. And it's very normal for that blood pressure to go up and down throughout the day. If you're exercising, it's going to be higher. If you're resting, it's going to be lower. So where the problem comes in is if at rest or persistently you've got really elevated blood pressure, that's what can lead to a lot of problems with your heart and even other serious health problems, like I was saying.
So how do you go about even measuring this? I think we've all been through the process, but I don't know that we actually know what's going on.
Yeah, what it actually means. I mean, it's pretty easy. Anybody who's been to the doctor, I'm sure, has had their blood pressure checked. And we always record it as 2 numbers, one over the other. So normal is right around 120 over 80, or anything below that is where you want to be. That top number is what we call the systolic blood pressure. That's actually when we're measuring the force of the blood against the artery wall when your heart is beating. And then when your heart is relaxing, that bottom number is what we call the diastolic pressure. So in between beats, when your heart's not squeezing, it's the lower of the numbers when your heart is relaxing.
Is one more important than the other?
No, they're really both important. In fact, sometimes you can have elevation in one but not the other, and it can have just as bad consequences.
So what does it mean to have high blood pressure?
Yeah, so high blood pressure is really when your systolic or your diastolic, the top or the bottom number, or both, are actually elevated. And like I said, that usually 120 over 80 is what our target is, and below that, if you're above that, then that means it's something to take note of. That increased pressure against your arteries is a high enough force at that level to cause some damage. And typically when that happens, you may hear your doctor call it hypertension instead of high blood pressure. That's the official term.
I know I've heard a lot of blood pressure myths, and let's go through them maybe if we can. If somebody would say, for example, I feel fine, so my blood pressure must be in a healthy range.
Yeah, and that's not always true. So a lot of people, like I mentioned, have high blood pressure and don't know it at all. In fact, at the beginning, the condition may not have any warning signs or symptoms at all. So that's why we sometimes call it the silent killer. And it's why you really need to make sure you're having your blood pressure checked often. You want to know that it's in a healthy range. And like we mentioned, your doctor's always going to check it at your appointment. It's one of those vital signs we do every time you come in, no matter what. You can actually also check your blood pressure on your own. You can do it at a pharmacy quite often, or you can get an at-home blood pressure monitor. So especially if it runs in your family, that's something that you want to keep an eye on.
Yeah, only problem, Doc, these guns are so big I can't get them in that blood pressure cuff at the drugstore.
They make those bigger cuffs for that problem, Tommy.
But people sometimes say high blood pressure is common, so it can't be that serious if everybody has it.
Yeah, it unfortunately is extremely serious, and if it's left untreated, that high pressure against your blood vessels can cause a lot of damage, but not only to the blood vessels, to some of the organs in your body as well. In particular, the heart, the brain, and the kidneys can be damaged by high blood pressure. So it's going to increase your risk for things like a heart attack or even stroke, and definitely we see a lot of kidney disease related to elevated blood pressures.
People sometimes think that it's an old person's disease, high blood pressure.
Yeah, I mean, it is more common as you get older, but it can develop at absolutely any age. I've had patients that are very young that have had elevated blood pressure, and actually, in fact, about 1 in 8 adults that are between the ages of 20 and 40 can be diagnosed with high blood pressure. So it's not only a disease of older individuals.
Yeah, I know it runs in families, correct me if I'm wrong, and I think some people are under the mistaken impression, well, if it's in the family, there's nothing I can do about it.
Yeah, it definitely has a really strong family prevalence. So if you've got a close relative with high blood pressure, you're more than likely going to develop it at some point in your life as well. But it doesn't really mean you have no control over it. One of the things you really need to think about is what are those healthy lifestyle choices that you make, because if you make those when you're younger, you may be able to actually push off the diagnosis until you're older or be able to control your blood pressure much better.
Quick break. We'll pick it up there. We come back talking about some healthy lifestyle choices you can make to prevent high blood pressure. That's what we're talking about with Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health. Seemingly not that important, but it is actually very important in terms of stroke, kidney disease, and more. More when we come back. 8:20 Traffic Now, WWL. All right, 8:25, Tommy Tucker, WWL, back with Dr. Brent Wallis, Dr. B, Chief Medical Officer of People's Health, talking about high blood pressure and how to prevent it. And, Doc, let's talk about some lifestyle choices that we can all do to help prevent high blood pressure.
Yeah, you can really lower your risk of high blood pressure if you exercise regularly and you eat healthy food. Those are really two of the biggest ones we talk about with this and a lot of other diseases. And then in particular for high blood pressure, managing your stress levels and not smoking. Those are really important. And you want to keep in mind all these healthy habits aren't just to prevent hypertension or high blood pressure. It's also really good for people that have already been diagnosed to help them treat and manage the condition a little bit better.
Why is exercise so important when it comes to maintaining your blood pressure at a healthy level?
Yeah, well, exercise, regular exercise, can really reduce your stress levels, which will help, but it's also going to strengthen your heart and help to lower your blood pressure. Your heart can work more efficiently, essentially. So we try to tell people get at least 30 minutes of physical activity at least 5 days a week, and it can be anything, walking around your neighborhood, dancing. It doesn't have to be real strenuous. Just get up and move.
Dancing around your neighborhood would be okay?
That'd be fun.
What kind of diet, when we talk about blood pressure, what kind of food should we be eating? What kind of menu should we have?
Yeah, so like other diseases, you want to really focus on plant-based foods and foods that are really not processed or refined. You want to eat plenty of vegetables and fruits. That's going to give you the highest amount of nutrients that you need. And then for proteins, you want to make sure you go real lean. Things like fish and whole grains and low-fat dairy products are really important.
And I guess there are some things to avoid.
Yeah, absolutely. And in particular with high blood pressure, lowering your salt intake is really critical. And the reason for that is, and you know this, when you eat a lot of salt, you hold on to a lot of fluid. And when you've got extra fluid in your body, the heart has to work harder to pump all of that blood around. And so you want to try to swap out your table salt for, healthy alternatives and spices, things like garlic powder, adding a little citrus or lemon juice or salt-free blends, and really try to limit those high salt foods, things like processed deli meats and canned soup, really anything canned, those salty snacks like chips and pretzels, and really anything that's prepackaged because it's usually going to be preserved with extra salt.
How can you tell if something is high in salt?
Yeah, in general, I tell people most food.
Let's get him back real quick if we can, because I'd like to find out how you can tell if food is high in salt. We're talking to Dr. B, Dr. Brent Wallis, Chief Medical Officer at People's Health. You can find out more about People's Health by going to peopleshealth.com. You can call them at 1-800-978-9765. And you can always go to the People's Health Medicare Center in Metairie. That's at 3017 Vets. Next to Party City, appointments are recommended, but walk-ins are welcome, and they are a 5-star Medicare rather supplement. What is the word? Dr. B is back. Doc, yeah, 5-star Medicare. What is it?
Hey, Tommy.
Hey.
Sorry, my phone disconnected
That's
on
right,
me there.
5-star. I was talking about finding out more about people's health. It's a 5-star Medicare supplement. Is that the word?
Yeah, 5-star Medicare Advantage plan.
Advantage plan,
And actually the only one in the state right now.
So there are different rules when it comes to changing throughout the year, right? If you're 5-star.
Yeah, absolutely. For some individuals, you can actually elect a 5-star plan and switch into that plan throughout the year. So you want to give us a call and see if you may be eligible for that opportunity.
So it's 800-978-9765, peopleshealth.com, or 3017 Vets next to Party City. Let's get back to the deciding if food is high in salt. How do you find that out?
Yeah, so like I was saying when we got disconnected, you want to look for sodium on the label, and anything that's labeled low sodium or very low sodium is going to really be what you want to target, because everything else probably is preserved with salt.
Diet sodas are high in sodium, are they not?
Yeah, some diet sodas definitely have sodium in them, so you want to look at that nutrition panel and make sure it's less than 140 milligrams of sodium.
All right. Now, what about managing stress and not smoking? Why are those so important?
Yeah, so your body can really handle stress in small doses, but if you are under constant stress, it's going to raise your blood pressure. When you're really stressed out, you may even feel that. You'll feel like your head may pop off, and it can cause a lot of these other health issues. So you want to try to find healthy forms of stress relief, meditation, yoga, and like I mentioned, exercise is really helpful. And then smoking, we know it causes all of these terrible diseases and illnesses, but really the nicotine in tobacco products also causes those blood vessels to constrict or tighten up, and it makes your heart beat faster. So what it does is it temporarily raises your blood pressure. So if you use tobacco, you may actually be causing high blood pressure or making it worse. So definitely talk to your doctor about quitting.
I don't know that we've talked about anything where smoking isn't a causative factor, have we?
Nope. It's pretty much on the list for almost every disease there is.
Thank you, Doc. Appreciate your time. Dr. Brent Wallis, Chief Medical Officer at People's Health. You can go to peopleshealth.com to find out more. We'll talk to Jeff Nowak, find out more about the Saints roster when we come back right now. Minute late, time for WWL First News.